In this video today, we are going to answer the question that's been asked many times. What is the cause of bleeding in early pregnancy? What is the cause of bleeding in early pregnancy? The type of bleeding we are talking about is bleeding from your private parts. So, if you are pregnant, the first 3 months of your pregnancy are what we call the first trimester. The first trimester includes the first 3 months. That is, if you got pregnant, let's say today, and this is the first month, the second month, and then the third month, that's what we call the first trimester. If you are a lady who is just pregnant, or you've just got pregnant and you are experiencing bleeding, the first thing we need to look at is this could be a normal sign of implantation. We call this implantation bleeding. We call this implantation bleeding, also known as spotting. It is brought about when a fertilized egg attaches itself onto the wall of your uterus, and as it attaches itself on the walls of your uterus, there's going to be actually rupture of the blood vessels, also known as lacunae. So when these blood vessels are rupturing as a result of this fertilized egg attaching itself onto the wall of your uterus, then there's going to be little bleeding, which normally lasts for only 1 day or 2 days. Now, if you experience heavy bleeding, which is also having clots, and recently your doctor, your midwife, your nurse checked you and told you that you could be pregnant, then this is a sign that there could be a problem. You should not just sit and maybe assume that everything is normal. It is a sign that you could be having issues whereby you need to talk to your doctor about this. Now, when you go to your doctor's office, the most important thing we need to take into consideration is that your doctor is going to request for some tests to be performed on you. The first test we are talking about includes the pelvic ultrasound scan. Also, it actually may depend on your doctor. They may also request for a rapid plasma reagent test, also known as an RPR test, to test for syphilis, or they could also look at your urine analysis results. So, talking about the pelvic ultrasound scan or the obstetric ultrasound scan, here images are taken of your womb, of your reproductive system, and most likely, if it's a pregnancy which is below 6 weeks, or actually if it's a pregnancy below 6 weeks, then we expect to see a well-defined gestational sac. A sac is that round structure where the baby is going to grow from, where the embryo is going to grow from. So all pregnancies below 6 weeks, there's going to be that sac, that round, that circular sac, which is containing fluid, which is also known as amnion, and then this sac goes on enlarging or increasing in size, and at around 7 weeks or 8 weeks, there's going to be a live embryo. A live embryo will be noted, also known as a fetal pole. And of course, when the pregnancy proceeds to 9 weeks, then we actually expect to see big changes happening inside the gestational sac. As a word of advice, when the pregnancy makes 9 weeks, you do the ultrasound scan today, and the pregnancy is 9 weeks, and still inside the sac, inside the gestational sac, there's no growth, there's no live embryo, then normally we call this a blighted ovum, also known as an embryonic pregnancy. An embryonic pregnancy is when the baby, the gestational sac forms, growth is taking place, but the embryo does not go in. In other words, an embryonic pregnancy or a blighted ovum is an empty gestational sac. It's always confirmed at 9 weeks, although in some countries, confirmation may be as early as 7 weeks or even 8 weeks. So we shall talk more about all this, but in today's video, we wanted to talk about bleeding in early pregnancy, and what you should take from this video is that if you are newly, you've been checked, you've been tested, They've checked your urine, the urine HCG test. You've done the urine HCG test yourself or at the clinic, and you've also maybe gone ahead and done the serum HCG test. The serum HCG test is where they get a blood sample, and then from you, the lady, and then from there the blood is taken through a machine which is known as a centrifuge. That is laboratory. You don't need to know all that. And then they take a sample of what has been prepared in the lab, known as the serum, whereby they will test for still the HCG hormone. If the tests have been shown to be positive, let's say the urine pregnancy test or the serum HCG tests are positive, then you go ahead and do a pelvic ultrasound scan. The doctor or the sonographer, the doctor doing the scan, tells you that, you know what, you are pregnant,